first, we're going to start off with Dana White. Now, I don't know if you know who Dana White is, but he's the head of the UFC. He started the UFC, right? And he's also started the Bald Man's Club, right? Him and Joe Rogan do the Bald Man's Club. And
they do a lot of good work.
They do a lot of great work. It started with Bruce Willis, and he's really
Bruno.
He's really grown that organization to include a lot of people you would never guess, even the guy from Titanic.
Really?
Well, one of them, not Leon
Zane.
Zane.
Billy Zane.
Billy Zane.
Yeah.
I saw him at a video store once. I was like, "What the fuck, your head?" And I couldn't believe it. But so here's Dana White. Now, he got sick with COVID, and he did the Joe Rogan regiment. And so he took a lot of stuff they say you're not supposed to take, like ivermectin and stuff like that. And then he got...
to be clear, they say you're not supposed to. That's not doctors, because his doctor said take that.
Right,
That's
his doctor said, no, the corporate news makes you think that ivermectin is a horse poison, when in reality it's a Nobel Prize winning medicine that is considered a miracle drug and treats all kinds of things and has been prescribed over 3 billion times. Now, that doesn't mean it treats COVID, but that doesn't mean that it's a horse medicine. And it doesn't also mean the CDC says they don't know if it treats it or not. That's what the CDC says with ivermectin. They go, hey, there's not enough evidence to say it does treat it, and there's not enough evidence to say it doesn't. That's what the CDC says. But again, they won't go do a study to prove it one way or the other. Isn't that interesting? Because anyway, we'll talk about it later. But the thing we're going to talk about here is monoclonals. So now I've told you that they've suppressed early treatments of COVID because if there was a treatment for COVID, they couldn't get emergency use authorization for the vaccine, and that's a fact. So it had to be suppressed. So I can't tell you what those treatments are because they'll take my channel down. But they did suppress it. And Fauci's been lying left and right. He lied about masks, lied about herd immunity, lied about funding gain of function. He said you were a conspiracy theorist if you thought that there was a lab leak that caused this pandemic. All that stuff. Now that's all been proven wrong. And Fauci's admitted he's a liar. But his YouTube channel is not taken down. So here they're going to ask him about monoclonals, which is a drug that treats COVID. And they never fucking tell you about it.
But Jimmy, that's made by a corporation.
Yeah.
So why do you think that's because corporation makes that?
The same corporation that makes your blood pressure medicine makes that. So why did you? So
is it your point that no medicine works because a corporation makes it?
Yeah. So here we go.
Hey Dana, you mentioned Omicron. When you got sick with COVID, you reached out to Joe Rogan for advice on what to do. I was wondering what your thoughts were with the 200 plus doctors trying to put pressure on Spotify, saying that Joe's a menace to.
Are they really?
Yeah.
Well, how about this? Ever since I came out and said what I did, it's almost impossible now to get monoclonal antibodies. They're making it so you can't get them. You know, medicine that absolutely works. They're keeping from us. I don't want to get too political and start getting into all this shit, but ivermectin and monoclonal antibodies have been around for a long time. Now all of a sudden you can't dig them up to save your life. The doctors won't give them to you, you know. And even when I did it here in Vegas, which was however many weeks ago that I had it, like right before Christmas, I think, or something. Yeah, I made one phone call and was able to get it done. And that's not like some fucking rich famous guy shit. Like anybody could have called and you know, because that's what everybody always throws at me. Yeah, of course you can fucking make a phone call and get it. Bullshit. Everybody could have got it back then. You know, Lene had it. Lene did monoclonal antibodies and did all that stuff. Everybody could get it. Now, and you know, Rogan's been talking about it. Then I went crazy talking about it. You can't get those things to save your life now. Literally.
Are you surprised at the backlash that people don't even want to allow you to discuss options and pre-treatment?
It's disgusting. It's disgusting. Yeah,
He's going to get to it in a second, but yeah, it's disgusting that they don't ever talk about vitamin D3, vitamin K2, vitamin C, fluvoxamine, monoclonals. They never talk about any of this stuff. ever. They never, all they do is vaccine, mask, and shut your mouth. That's all they talk about. And why? Because they're all corrupt. That's why. So here we go. Watch this.
Craziest things that I've ever witnessed in my life. You know,
He's saying it's the craziest thing he's ever witnessed in his life. People not being able to get drugs that can help them, and while they're being suppressed by the establishment medical community.
You know what, Jimmy? I blame Joe Rogan for this.
I blame
if he hadn't spoke about how he was treated.
with monoclonals, then they would have still been able to be available. But here we go. Watch this.
and we're not talking about experimental drugs or things.
No.
This stuff's been around. And the ivermectin,
You're a doctor?
The guy won the Nobel Peace Prize.
You're a doctor?
Huh?
You're a doctor?
No, but there's plenty of doc.
So a guy who apparently is a reporter says to him, "Are you a doctor?" You don't have to be. No, you don't have to be a doctor to know what's going on. You need to be a detective. And that guy, you're a journalist, and you're shaming someone for speaking about their personal experience. That's the opposite of journalism. So what that guy is a propagandist who's shitting his pants. That's what whoever that person was. Do you hear that? Are you a doctor? What? No, he's a guy who got sick with COVID and his doctor prescribed something for him. And now he knows for a fact that you can't get monoclonals. They're so much harder to get now than when he and Joe Rogan got them. Why is that? That reporter's not curious at all. That reporter's a propagandist, not a reporter.
Well, I like that there's reporters listening to the Forbes don't do your own research.
Yeah.
Even the reporters shouldn't do any research.
Yeah. Right? So what? It keeps going.
There you go.
That
Here he comes.
I just asked a question. Are you a doctor?
Just a question. I just asked a question that's completely supposed to shame you and shut you down and tell you that you're not really qualified to talk about this. That's all I did. That question doesn't mean anything. And it doesn't. Why? And then so he's such a pussy, he can't even take responsibility for the question. We all know what the fuck you just meant, you pussy. Dana White knows what you meant. I know. And guess what? You know what you meant, but you're too big of a fucking coward to own it. I'm just saying something. That doesn't mean anything. Why do you want to know if he's a doctor? You know he's not a doctor, so you weren't actually asking that question, were you? No, he was making a statement. You're trying to shut him down and embarrass him. But you're the one who should be embarrassed because you're the opposite of a reporter and you're the opposite of an American. I wish I knew who that guy was. You know he's shitty. Watch this.
No, but I took them and they both work for me. So why shouldn't I be able to take them again? Or other people?
I won't answer.
No, come on.
I won't answer because you don't have an answer. Because that guy doesn't have an answer. That's why. I won't answer. Why? Because I'm a pussy. That's why. Because I'm a coward. I don't have any intellectual consistency. And I'm going along with the herd. It's a cult. It's called the COVIDian cult.
Dive in.
We do have a brain.
Why shouldn't we be able to take
our
them?
own decision?
Right? You want to know what's scary? I bet I could get some fucking pain pills quicker than I could get monoclonal antibodies. No, not maybe. That's a fact. That's a fact. They fucking hand out pain pills like they're Tic Tacs.
Nobody said that was right.
Huh?
So now he's got an answer. So now the guy goes, well, nobody said that was right. Yeah, but what Dana White is saying...
Didn't his doctor say that? A doctor said it was right.
But what Dana... No.
Oh.
The guy said, nobody said it was right that everybody should get pain pills. And first of all, yes, Big Pharma did for fucking decade and maybe 2 decades say you should. Yes. A. And B, what is that? No, Dana White is saying, why is it I can get a drug that's going to kill me, but they're keeping me from a drug that might save me? That's the question, dummy. Do you see how it is when you have to debate or have a discussion or an argument with these people who are branch COVIDians? They got brainwashed by Big Pharma. You can't have an honest conversation with them.
Jimmy.
There's circular logic. I mean, it's all circular logic. When I debated about the mandates, it was all circular logic. It was like, hey, you're gonna get you're gonna get it anyway. Yeah, but if it'll be less. No, it won't be. Yeah, but don't you want to help people? That has nothing to do with helping people. You're all gonna get it. Go ahead, Kurt. You want to say something?
It was Yahoo sports reporter Kevin Iole.
Wow,
it's a sports reporter. Are you a medical reporter?
Are you? What does he know about medicine? How do you know that the pharmaceuticals were wrong when they told everybody to take extra OxyContin? So now you're a doctor? Now that guy's a doctor. No, what that guy is a brainwashed fucking repeater of propaganda and the opposite of a reporter. And a pussy, by the way, of the highest order. And if you want to come on my show, you're welcome to come on my show.
Do you think
because more people will see you look like a fucking moron on my show than will ever read anything you ever write. Guaranteed.
You know what he looks like?
This will be your big break. You could come on my show. This will be your big break. Go ahead, Kurt.
If you look him up, he looks kind of like if John Lithgow looked like a pussy.
That guy is a pussy of the highest order. And so here, I don't know if I'm allowed to do this because I'm not a doctor. Am I allowed to read the newspaper? Do I have to have a journalism degree to read the newspaper? Somebody should have asked that guy, you're a journalist? Did you go to journalism school? Because I guarantee you fucking didn't. And because there's only two kinds of people who go to journalism school, right? Shitty journalists and dupes. Maybe that guy did go. I think he probably did, now that I think of it. I bet you he did go to journalism school. Hey, you don't have to go to journalism school to be a journalist, you dummy. You don't have to pay anybody any money. You could just be a journalist. Big demand, just like comedy. Just like being a singer, just like being a writer. You don't have to go to school to do any of this shit. You just do it if you can do it. I didn't go to comedy school. Big demand makes COVID fighting antibodies hard to get in California. That's from September 21. Why is it hard to get antibodies in California? Here's another one. Monoclonal antibodies save COVID patients. Why are they hard to get? That's the Washington Post. Do I have to be a doctor to say that? Do you have to be a doctor to read the Washington Post? Here's CNN. Doctors are often unaware of the only treatment for early COVID-19. There it is. Are they doctors who wrote this? No, they're not. The people who wrote this are not doctors. The people who wrote this are fucking hack journalists just like you.
When did that come out?
This came out October 25th, 2021. That's by Elizabeth Cohen. She's a senior medical correspondent.
But is she a doctor?
But she's not a doctor. So how could you ever? How does she just? So she shouldn't get to talk like this, or talk about it, because that's what America's all about: restricting people's speech.
You should know that Kevin Iole has a Nat Fleischer Award for career excellence in boxing journalism. So I think you probably feel like an asshole right now.
I do feel like an asshole. Yeah, I mean, then he certainly would know a lot about the OxyContin craze that went across. Right? He would be an expert to talk about that. Although he felt like he was, he chimed in on that, but he wouldn't answer any of the questions that Dana White had to ask him. Hey, so why shouldn't I be able to get those drugs? I'm not going to answer. Why? Because you'd look like an idiot.
You know.
Yeah, that's why. That's why. That'd be why.
He looks like a guy that got lap band surgery and used to be fat. So I'm guessing there's a touch of Ethan Klein. Well, don't say I'm not healthy at any. I'm sure there's something about that in it too.
What's his name?
Kevin Iole. I guess it's Iole or Iole.
So he's basically an oil-based substance, right? He's very oily. And that's a perfect description of a guy like that. Very oily. Very oily. What a fuck. And he won't come on the show. Why? Because he's a pussy. That's why he won't. That's why I can have an open door policy for him to come on. He's not coming on. Believe me. More people would see him on my show that are ever going to read anything he writes combined for the rest of his fucking life. And he won't come on. Why? Because he's a pussy.
And we like pussies. I mean, that's...
yes. Ready?
Friends of the show.
On September 17th, this is from frickin' CNN. But apparently, Dana White's not allowed to talk about this. Stuff that's been reported on widely. Dana White's not allowed to talk about it, according to Mr. Iole, because Boy, is that a spicy aioli? I bet it's not.
You're thinking of aioli.
Oh, yeah, I'm thinking of aioli.
The mayonnaise.
Yeah, aioli. Hang on, I got to move over. There we go.
Thank you.
So here's from CNN. You want to hear how hard it is to get monoclonals for absolutely no reason? Here we go. On September 17th, Myra Arana made the phone call she says saved her life. Arana had been vaccinated against COVID-19, but she developed a breakthrough infection. She feared the virus might kill her since her immune system is weak after years of treatment for leukemia. Arana's family physician in California told her there wasn't much she could do besides stay at home and rest. That's not true. There are treatments. At home, following her doctor's advice, she got sicker by the hour. Her husband placed a pulse oximeter on her fingertip, and it showed her blood oxygen levels were dipping dangerously low. Getting more and more worried, Arana called her oncologist at the University of California, San Francisco. It turned out her family physician was wrong. There is a treatment for early stage COVID-19. By this point, Arana was so weak she couldn't walk on her own. Her husband, a school bus driver and custodian, got her out of bed and drove her to the UCSF Fresno, where she received 4 shots of the treatment called monoclonal antibodies. Wow. What did she do? She used horsoclonal ponobodies? No. Why are they spreading this medical misinformation? Why isn't she being silenced? She's taking horsoclonal ponobodies.
They come from ponies.
Don't they come from ponies? The next day I could feel a difference. 2 days later, I could get out of bed and clean the house and feed my children, she said. I really do think the antibodies saved my life. Wait, CNN actually did this investigation? Are they sick? Did someone die? Why couldn't they write whatever they saw on Twitter just like normal? What are they doing? They're doing a real news story. Wow, my hat's off to this writer. The senior medical correspondent over at CNN. I wonder who let her say this. I wonder why she was allowed to say this, because I'm telling you, Big Pharma doesn't want them to know this. So this must have been, I bet she got in trouble for this.
Shouldn't a boxing journalist be handling this story?
I think so. So here we go. Next one. An investigation by CNN. They did it. They did an investigation. An investigation by CNN shows Arana is not alone in her challenge to find monoclonal antibodies. Many patients who qualify for the drugs say their doctors never mention them. So do you see what I say you've been lied to since the start of COVID? What I mean? You've been lied to since the start of COVID. They have suppressed early treatments. Not only this, they've lied to you repeatedly, and guess what? They're still lying to you. So many patients who qualify for the drugs say their doctors never mention them, even though it has been nearly a year since the antibodies were first authorized. Now it's been a year and a half. Have been first authorized by the U.S. Food and Drug Administration. They're the only treatment for early COVID, and studies have shown they can dramatically reduce the risk of hospitalization and death. Now, I'm pretty sure fluvoxamine has also been proven to be a treatment. Can you Google that stuff?
Yeah.
I know I saw Dr. John Campbell talk about the fluvoxamine, but we're going to double check that right now. They're the only treatment for early COVID, and studies have shown they can dramatically reduce the risk of hospitalization and death. I wonder why Fauci doesn't mention them every time he opens his mouth. I wonder why the head of the NIH never mentioned monoclonals. I wonder why Dr. Sanjay Gupta and Don Lemon don't talk about monoclonals. I wonder why Rachel Maddow isn't tweeting about monoclonals, because it's a great early treatment. I wonder why none of them are doing it, and I'll tell you why. Because they're all bought and corrupt, and they're getting their money from Big Pharma. Rachel Maddow gets $60,000 a fucking day from Big Pharma, okay? Or thereabouts.
Do you know what's sad, Jimmy? That boxing guy, he was not getting paid. He just is being a good boy.
Yes, he's just being a good boy. Our friend Aioli, he's not getting paid directly from Big Pharma. He's just a good boy. He's not going to go against the establishment. Don't worry about it. And Dana White's a bad guy because he's speaking honestly from the heart about his experience. So he should shut up.
That's toxic.
It's like saying, hey, I don't think we should go to the Iraq war. Hey, are you a general in the army? Hey, I think we should try to fix this homeless problem. Oh, I don't think you're poor. What do you know about
Are you
it?
homeless?
Are you homeless?
Are you a Girl Scout?
Right.
Jimmy, I just wanted to let you know that I saw on the Philadelphia Inquirer, another old drug is being tried and might actually help. Fluvoxamine, a 40-year-old drug that cost a fraction of the price of new treatments for COVID, now looks as if it might help actually.
And why do you think they don't want to let you know about that drug? Because it's fucking cheap and they can't make money off it.
Can't we just
That's
let them
why.
jack the price up?
So, and I know, why don't you just jack the price up of all these drugs and then let us get healthy? No, they have new drugs. That's what this is all about. Why aren't they telling you about monoclonals? No one's curious. That Aioli guy, you're not curious that the medical establishment is keeping early treatments from people? That doesn't get your ire up. What gets his ire up is someone talks about it. Isn't that something?
Dude, you know what's wild? I remember when that Kids in the Hall movie Brain Candy came out, and I didn't get it way back when it came out, and that movie was all about this. It's amazing how much stuff they nailed in that old movie. This has been for a while. It's been like this.
What movie was that?
Brain Candy.
Oh,
It's
okay.
about a drug company remarketing a drug for
Oh,
everyone.
that's right. I remember
Yeah.
that. Yeah. Okay, let's keep going. It's unconscionable, said Dr. Peter Chin Hong, an infectious disease expert and professor at the University of California, San Francisco School of Medicine. We have an evidence-based drug, and it's provided free by the government, but there are barriers built into the system to get it. Wow, isn't that wild? Barriers, like if someone brings it up at all, the entire mainstream press will attack them for it, except for right now for some reason. So anybody else brings it up, they get attacked, just like Dana White did. But for some reason, CNN is being allowed to tell the truth right now. As COVID-19 numbers surged this summer and early fall, some hospitals and even community groups rose to the occasion and started helping large numbers of patients gain access to the drugs. But some major, well-resourced medical centers say staffing and space shortages have prevented them from offering more than just a handful of treatments per day. Are you does anyone believe any of that? Does anyone believe any of that? Wow. Well, thank God. Here we go. Some hospitals simply are not in position to reallocate resources for providing monoclonal antibody treatments, said Akin Dieman, the American Hospital Association's director of policy. Right. Why is that? Why are some hospitals not in a position to reallocate resources and provide monoclonal? Why is that? We passed a $5 trillion stimulus bill for COVID. None of that money, not a couple of billion, went to No. Right. So the reason why this is, I'm going to tell this guy who's the head of the American Hospital Association's director of policy, because apparently he doesn't know it, but a pothead comedian in his garage knows it. Here's why they're not available. Because of neoliberalism and capitalism and corporatism and a bought government. That's why. So now do you know why they're not available? Did I tell you again, you fucking genius? You dummy on purpose? I don't know why. Yeah. Nobody knows what's going wrong in this for-profit fucking not capitalistic hellscape of a healthcare system where we suppress early treatments, keep drugs from dying people so we can increase the profits of big pharma. That's exactly what's going on. The reason why there aren't ICU beds is not because we can't afford them, but because they're not profitable. And so we never have enough ICU beds, and every flu season, they get overrun. Can you turn this off?
Yeah.
Because the neolibs who run our healthcare system are busy trying to make a profit off everything. Akin. That would be why. Akin. You fucking liar. At a White House briefing at the end of August, Fauci, President Joe Biden's senior medical advisor, listen to this. He implored doctors to use monoclonal antibodies more frequently, noting that they can reduce the risk of COVID-19 hospitalization or death by 70 to 85%. That's so funny because I have seen Dr. Fauci on TV a million times. And you know how many times I've heard him say this? Zero. Why wouldn't this be the first thing out of his mouth every time he talks about COVID? I'll tell you why. Because Dr. Fauci is a corrupt criminal who is keeping information from you on purpose at the behest of Big Pharma. That's why. Because Dr. Fauci is a criminal who should be in jail, and that is not hyperbole. He is a bigger liar than Ted Cruz and Rand Paul put together. He's been lying for 40 straight years and screwing over American people. Okay, hang on. I got to get my jokes. So, Fauci urges hospitals to use more COVID-19 antibody treatments. Look at that. This is very effective intervention for COVID-19. It is underutilized, and we recommend strongly that we utilize this to its fullest, Fauci said one time under his breath. We want people out there, including physicians as well as potential patients, to realize the advantage of this very effective way of treating early infection. What? I'm going to bet you the first time most people heard about this was on this goddamn show. When asked by CNN why more doctors and health centers aren't getting antibodies to their COVID-19 patients, Fauci said, "I can't explain that." Oh. Wow, so I guess there are some things that science just can't explain, huh? What happens to us when we die? What is consciousness? And of course, why is the effective treatment for COVID being blocked? Those are some of the questions we'll just never be able to answer. You motherfucker. They wouldn't explain why. They won't explain why. Star Kitt did everything she could to get monoclonal antibodies for her father, and she failed. Last month, Kitt's 68-year-old father, John Daniel, who lives outside of Atlanta, he tested positive for COVID-19, even though he was fully vaccinated. He had a fever for days and couldn't get out of bed. 5 days after he started feeling ill, Daniel had a video call with the physician's assistant in his family doctor's office. Daniel says she made no mention of the monoclonal antibodies, even though he's over 65. Okay. Then his daughter, a psychologist with the U.S. Department of Transportation, spoke on the phone with her doctor, but she said he also made no mention of monoclonal antibodies. Wow. Doesn't that tell you that America has the best healthcare system in the world? I hope he didn't become radicalized for Medicare for all or something because of this. I hope not. Here we go. Kitt's cousin, a nurse, then told her about the treatment. So Kitt had called a government hotline for monoclonal antibodies and was given the names of the numbers for 10 treatment sites near her father's home. 8 of them were like, "Why are you calling us?" she remembers. Can you fucking believe this?
I mean, you have to call Dana White. 8 doctors won't.
That's right.
Won't tell you.
Because doctors won't tell you about it. You got to call Joe Rogan and Dana White and listen to a pothead comedian's podcast. Let me read this. The 9th treatment center said her father would need a referral from his doctor. Kitt called her father's doctor, but she said she wouldn't give a referral and wouldn't explain why. Is it because, I don't know, doctors' boards and things are pressuring people to only use the vaccine and not use those treatments? Is that why? Because that's what my doctor told me. My doctor told me that they sent out a letter to every fucking doctor and doctor association and hospital and warned them that doctors are going to lose their license if they start telling people about treatments. That's what my doctor told me. That's what my doctor told me. So why is this happening? I'm going to guess that's why it's happening. Because Big Pharma has a stranglehold over our medical system and our corporations' corporate news and our government and our FDA, CDs. The big pharma has captured them, and they're corrupt.
Why is CNN reporting that? Is it like a thing you can just slip in? Like, why would they even be? Did someone get breakthrough COVID and they couldn't get monoclonals who works at CNN?
Maybe that happened. But here's this woman. She's doing her own research. Now, you're not supposed to do that.
Yeah.
That's shunned now today, even though she's a doctor. So here we go. There's more. The 10th center said it would take the first 50 people who showed up in the morning. Daniel arrived 15 minutes after the center opened, and there were already more than 50 people in line. Well, why were you late? Her father never did get an antibody treatment. It took him weeks to fully recover from the virus. I just don't understand why it didn't happen. I just told you why. Because we live in a corrupt system that's run by Big Pharma's money. Big Pharma made, just Pfizer alone, made $35 billion off their vaccine. That one vaccine. Forget about all the rest of the drugs they sold. They made $35 billion off that one vaccine. How much money, power, and influence does that $35 billion buy you? Well, I've said this on the show before. The entire recording music industry in the United States only generates $12 billion a year. The entire recorded music industry in the United States only generates $12 billion a year. Pfizer, one company, is going to make $35 billion off that one vaccine. And then they own the news media and they own your government. And now you know why you can't get real treatments? That's why.
I mean, Jimmy,
why did they make ivermectin sound like a poison horse paste? Because they're bought by Big Pharma and they can't make money off ivermectin because it's a generic. Go ahead.
I was going to say, the music industry only makes $12 billion. That's only enough for like 3 years worth of Pfizer fines for false.
That's right. Okay. Hey, in New York, months ago, a shoemaker, a lawyer, and 3 housewives saw the need for antibodies in their community. By the way, a shoemaker, a lawyer, and 3 housewives. That sounds like the beginning of a joke, doesn't it? Am I wrong? But it's not a joke. And in fact, it's just a reality, sad reality of our garbage healthcare system. A shoemaker, a lawyer, and 3 housewives saw a need for antibodies in their community. In September, the group called CPI arranged for several hundred antibody treatments a week, she said. Isn't that something? Bernstein said she often finds herself on the phone explaining to physicians the benefits of antibodies and which patients are eligible for them. I'm not a medical professional, and here I'm telling doctors things they don't know. Hey, Mr. Aioli, I don't know if you saw this report from CNN. Bernstein said, and hands down, we have saved lives. I can't walk down the street anymore without having someone say, you saved my life.
I hope she's in prison now.
Yeah. Dr. Lindsay Batten, an infectious disease specialist and associate professor at Harvard Medical School, said some medical systems might have been slow to implement antibodies at first because they weren't sure how well they worked. Oh, that's why? Let's just let the guy die. Should we try the monoclonals? I don't know if it works. Well, should we try it? I say we let him die. What the fuck kind of bullshit is that? But as additional data emerged in real time, he said the treatment's effectiveness has become clearer. He added that it can be hard for institutions to operationalize a new treatment, even though it involves shots or infusions, both of which are given in hospitals countless times every day. Isn't that amazing? Wow, it's so confusing. How do we get this treatment to people for COVID? There's just a million problems. How do we get them the vaccine? No problem. Everybody can get it anywhere outside anytime. What about the monoclonals? I don't know what. It's systems and operationalized, and we got to get the things, and I don't know. My doctor doesn't even know about it, but how can I get the vaccine? Every corner in the fucking America, you can get the vaccine. What about monoclonals? Yeah. It should be easy, but there's infrastructure. There's fluid bags and pumps that have to be set at the right rate and the right tubing. And not every tubing is right for every pump. And you have to have a computer system that allows you to put it in the right order and the right label on the right bag. You know, like medicine. You know, like how you have the right label on the right bag so people get the right fucking drugs? You mean why there's a chart hanging on the foot of everyone's hospital bed? You mean that kind of a thing? Go ahead.
The mask, you're going to be fiddling with it and you get some schmutz. You don't want the masks and the monoclonals.
You don't want the schmutz and the thing. And you might think a mask helps you, but it doesn't help you. That's what Fauci said, and then admitted he was lying. None of this is rocket science, and I'm not raising this to say these are insurmountable, he added. These are speed bumps, but this is all solvable. This is a solvable problem. Yeah, I know. What the fuck? None of this is rocket scientists. A doctor is saying that? A doctor is saying that. You know, doctors aren't rocket scientists, so that's encouraging. So now Dana White is a rocket scientist. Look at that.
Wait,
now,
are you a rocket scientist, Jimmy? Are you a rocket scientist?
I'm not a rocket scientist. So, by the way, it shouldn't be this hard. Colorado COVID patients struggle to get monoclonal antibodies. Why would it be hard? Why is it hard? Unless our institutions absolutely suck and we should rethink every level of our for-profit medical system. Oh, maybe that's it.
Wait, our efficient private system? What?
Why would you want to change this?
What are we, socialist? Why is it hard?
That's right. There's a shortage, Kurt. There's a shortage of monoclonal antibody treatments. Here it is, Forbes, and that's from December of 2021.
Oh.
COVID patients have trouble getting monoclonal antibodies treatment due to short supply. It's heartbreaking. That's from December 30th. Monoclonal antibody treatment still difficult to obtain. This is from January 7th, 2022.
I know what it is.
What is it?
We probably need it for the horses.
That is
it.
You
can't just take their medicine all the time.
Right. We're giving them monoclonal ponies. So this one says COVID-19 therapies are scarce in San Francisco as Omicron surges. Health officials, listen to the subhead, health officials cling to vaccines and boosters as the way forward.
But what if I got breakthrough COVID and I'm all vaccinated?
Why are they clinging to this? Again, not mentioning monoclonals because the monoclonals are scarce. Also, here's that I already showed you that. This is the stupid. That has nothing to do with this.
Good stuff.
Good stuff. That's the good stuff. So there you go, ladies and gentlemen. Now you know the story of monoclonals and Dana White and how the establishment is keeping them from you on purpose. And Fauci doesn't know why. They don't know why. I think we all know why. Because our entire medical system is bought by Big Pharma. $35 billion in 1 year gives you enough money to buy several governments and several big corporate news stations. And they've done it. And you're a chump. And you're a dupe because you're being lied to at the speed of science every fucking day.
The speed of
every day you're being lied to. And guys like my close friends who are for mandates have no idea what they're talking about and have become unbelievable authoritarian pussies like Howard Stern. So shame on you for repeating propaganda uncritically that came straight from Big Pharma. Shame on you for not fucking criticizing that criminal Fauci and that criminal who used to head the NIH and the criminal corporate news people who keep lying to you about COVID. Shame on you.
Can you imagine, Jimmy, if there's any unvaxxed rocket scientists out there? There's got to be one.
There's got to be one.
Howard Stern would call for them to die in space.
If people knew how many PhDs are unvaccinated, it would make their head explode. We added a second show, January 26th in Raleigh, and we're going to be in Philadelphia on February 20th. Go to jimmydorecomedy.com for a link for all our tickets. And while you're there, become a premium member. Get access to all our premium videos.